Hi everyone. This is just a little presentation on post-pregnancy body and what to expect and what kind of rehab you might need to do to get back to some sort of level that you were at before having a baby. So this is for anyone post-pregnancy, no matter how long post-pregnancy you are. So once you have a baby, realistically your body changes and you generally don't get back to the same body as you had pre-pregnancy. So it's just to give you an idea of what is common to expect post-pregnancy and what kind of things that physio can do to help you get back to as much of a normal as you can. Just to give you a little bit of background on who I am, my name is Sarah. I'm a chartered physiotherapist at Resync Physiotherapy Clinic. I also have a degree in health and performance science. And once I started working, I saw how, I suppose, underrepresented women's health and post-pregnancy rehab was, and how, the post-pregnancy body is totally different to an athlete or to any other body, and it needs to be treated that little bit differently, and it usually requires different rehab and different input. So it just caught my interest. I did a Pilates course to become a Pilates instructor. I then went on to do pregnancy and postnatal Pilates, and now I'm doing a core exercise solution pregnancy and post-pregnancy corrective exercise specialist course to get a little bit more into helping people with their bodies after having a baby. So this is just going to run through quite a basic presentation, not getting too complicated on you because it can get a little bit confusing. So we'll just run through it from the start. So what happens to your body whenever you are pregnant? So obviously there is pressure of the baby on your pelvic floor for 9 months. So that's a long time to be experiencing a kind of a stretch on a muscle or a pressure on a muscle that it's not used to. When the baby is growing in the front, your abdominal muscles are stretched and lengthened, and your center of gravity is changed. So the weight of the baby is sort of pulling you forward a little bit as well as stretching the abdominal muscles. So this tends to feed into a bit of a curve in the low back and what's called an anterior pelvic tilt. So whenever you're in this position, the ribs are also pushed forward and out. And it just leaves little room for a big breath and for the diaphragm to move fully. Whenever we breathe, our diaphragm is, if you imagine a kind of a cylinder, our diaphragm pulls down as you inhale to get a breath in, and then it comes up as you exhale. So whenever there's a baby in there, there's little room for the diaphragm to be able to move fully and for the ribs and rib cage to be able to fully expand. So this kind of leads to a different posture post-pregnancy. So then the common post-pregnancy posture is then that ribs flared position, or the ribs stay thrusted forward. So sometimes because of the center of gravity change, the ligament laxity, changes in muscle strength and length, it leads to the ribs being thrusted forward and staying in that position unless corrected, a little bit of an anterior pelvic tilt. When you're in this anterior pelvic tilt, it's harder for you to get your core muscles to engage and kick in. And then the pelvic floor and the back of the body are also compromised in this position. So I'll show you just a little photo of me trying to demonstrate this. On the left is, I suppose, like a normal posture where you can see if you were to draw a plumb line down from my ear to my shoulder to my hip bone to my ankle, it's relatively straight. So this is the kind of optimal posture we'd be looking for. And you want your rib cage to be stacked directly over your pelvis. So if you look to the right then, if you look at my rib cage and my pelvis, you can see that the rib cage is forward and in front of my pelvis. You can see the curve in my low back, the couple of arrows pointing there. You can see my anterior tilt. So my whole pelvis, if you wanted to sit like this with the front and the back of the hips quite level. In an anterior tilt, it's tilted forward, so you get that arch in the back and a tightness in the front of the hips. The abdominals stay lengthened, rib cage is thrusted forward of the pelvis, but it's also pushed out and up. You can see in the back as well that whenever we get that what's called a lordotic curve in the low back, it tends to be coupled with rounded shoulders as well. So this is not only from pregnancy, but it's also from the early stages of having a baby. So anything that you do tends to be hunched forward, like feeding, carrying, lifting, anything like that. You tend to have this hunched forward, rounded upper back. And what this leads into then is tightness across the chest. You can see there that my shoulders are pulled forward. So the front of the chest, the pec muscles get tight, and the upper back gets stiff because it's stuck in that rounded position. It's not as flat as it is in a photo on the left. And then it also means that the muscles of the shoulder blades and of the back get a little bit weak when they're in that lengthened position and we're tight at the front. The muscles of the back kind of get weak and long. So we want to strengthen them as well. Once we improve the mobility of the shoulders and mobility of the upper back, we want to strengthen those shoulders and strengthen the back to help to keep you in that position. You then go up to my head and my neck. So my chin is poking forward. So this usually comes in combination with the rounded upper back posture. So it's called an upper cross syndrome. And it's basically where the chin pokes forward, we get tightness in the back of the neck. And whenever your chin or your head is sitting a little bit more forward of your center of gravity, like it is in the photo on the right, your head weighs a lot more. So it's a lot more stress for your neck muscles to be carrying and a lot more load for your neck muscles to be carrying. So we ideally want to then, again, like the upper back, bring the chin back, lengthen the muscles at the back and strengthen the muscles at the front of the neck. So you're bringing your head back over your shoulders again. With the coming back down to the pelvis. So what tends to happen again in this anterior pelvic tilt, the fronts of the hips and the fronts of the thighs tend to get quite tight, your hip flexors and your quads. Women in general tend to be quite quad dominant, so very strong in the front of their legs and in the front of their quads, and not quite as strong in the backs of their thighs and their glutes, so their hamstrings and their glutes. So again, when we're in this position, it makes it a lot harder to even try and engage and use those muscles as well as we could, the glute muscles and the hamstrings. So it's important to try and reduce the activity of the front of the legs, and we want to try and kick in the backs of the legs and kick in the core and the tummy to help to bring that pelvis back underneath. So from photo number 2, where it's tipped forward, we want to bring it back underneath the rib cage, like in photo number 1. Same with the rib cage, we want to bring it back over the pelvis so that the rib cage or the diaphragm and the pelvic floor can work together. So I'll go into this in a little bit more detail in a minute. The pelvic floor, so just in case you're not entirely sure what it does or what happens to it. So as I said, there is pressure on the pelvic floor throughout the whole of the pregnancy. So this, you're at the same amount of risk in terms of having a weakened pelvic floor after pregnancy. No matter if it's a natural delivery or a C-section. Even with a C-section, you can have that weakened pelvic floor just because there is that 9-month-long pressure through the pelvic floor. So just to bear that in mind, a lot of people think if they had a C-section that they shouldn't end up with any pelvic floor issues, and that's just not the case. The role of the pelvic floor. So the pelvic floor is basically a group of muscles that go from the front, so the pubic bone at the front, and sling around to the coccyx at the back. So it's a sling of muscles to support underneath. And then they're in between the 2 sit bones. So it's kind of a hammock-like structure. Their role then is to prevent leaking. So they support the bladder neck and to support the internal organs. They also have a really, really strong role in core stability. So it's quite common for us to see women post-pregnancy with back pain. And this is usually due to a reduced stability in their core. So from the posture that I mentioned in the previous slide, and the reduced core stability and reduced core work from the pelvic floor and the front tummy muscles, then that feeds into that posture and the back pain. So leaking during and post-pregnancy is very common. So it's not normal and shouldn't be accepted for a long time after pregnancy, but it is common. So just to bear that in mind, that you know, you're not alone if you're experiencing this. It's very, very common and just generally not talked about quite as much as it could be. You ruined my video. It's okay, I should have told you. It's halfway through our presentation.
I could have sorry again.
Yeah, I stopped it. Might
I can.
So what is the role of the pelvic floor? So the role of the pelvic floor is basically for support, organ support. There's a sling of muscles that go from the front, the pubic bone, all the way to the back, to the coccyx, and they are like a hammock sort of structure. Whenever you are pregnant, the pelvic floor sits at the bottom. So whenever you have a baby, there's pressure through that pelvic floor throughout the whole pregnancy. So no matter if you have a C-section or a natural delivery, you are still at risk of having difficulty or a weakened pelvic floor after being pregnant. So a lot of people think that if they have a C-section, that they should have a perfect pelvic floor afterwards, and that's just not the case because of a number of factors. One being that pressure and strength loss in the pelvic floor for the 9 months, but also when you have a C-section, your abdominals are cut so that this reduces the support and strength of the abdominal muscles, and your whole canister of support, being your pelvic floor, your diaphragm, and your core muscles, all need to work together to have an effective pelvic floor and to also prevent things like back pain and just have a really, really stable center. So as I was saying, the role of the pelvic floor, it's to close the bladder neck and prevent leaking and to support the internal organs, but it also has a really, really key role in that pelvic stability. So if you imagine a can of Coke, so this is just to kind of go into your canister of support in the center. If you imagine a can of Coke, the top is the diaphragm, the bottom is the pelvic floor, and all around is your core muscles. So they're called your transverse abdominis muscles. If the lid is open and it's a little bit empty, it's a lot easier to crush that canister than it is if it's full. It's really stable and strong if all of the areas of the can are closed. So this works the same for the pelvic floor. If your pelvic floor isn't strong enough, it's as if the top of the can is open, so you don't have quite as much stability, or intrathoracic pressure is what it's called, within the core to help to support your spine and just help you to transfer load effectively. So we want to restore everything. So we want to restore the diaphragm and the rib cage mobility. We want to restore the tummy muscles and the pelvic floor strength to get this strong canister of support back, which they all feed into each other. So if you're not breathing properly, if your diaphragm isn't working quite as well as it could, this can lead to the pelvic floor malfunctioning and vice versa. So that's why we want to target all of these things together. Leaking during and post-pregnancy is very common. So we don't want to accept it for a long time after pregnancy. And it's, you know, we can help you with it. Definitely. A lot of people don't talk about it. A lot of people don't know how common it is. And a lot of people just accept it, but there is help out there for getting this back to normal. So just bear that in mind. And this is what we're kind of trying to go into today. It's usually due to weakness in the pelvic floor, but it's not always. So the kind of first step is usually that it is commonly due to that little bit of weakness in the pelvic floor, but it can be due to a multitude of other factors, such as actually the pelvic floor being too tight, or other things within that canister of support that I was just talking about that isn't working as well as it could. So there are a couple of different types of incontinence to look out for as well. So I suppose stress urinary incontinence is that typical kind of little bit of leaking when you're coughing or sneezing, or if there's a sudden movement or you're jumping or something like that. Which again is commonly due to just weakness, that pelvic floor can't support the bladder neck as well as it could whenever that increased pressure is bearing down onto the pelvic floor. So again, imagining that canister of support, the intrathoracic pressure within that support. If there's too much and the pelvic floor isn't strong enough to support it, then that's when you can get that little bit of leaking with the stress urinary incontinence. Incontinence is, I suppose, a big subject that you could talk about for ages. So I won't go into too much detail about any of the other types, because that is generally the most common one after pregnancy. So because it's commonly due to a weakness in the pelvic floor, it's really, really important to do pelvic floor strengthening exercises quite soon after pregnancy and continue them for a while. The research has shown that if you are experiencing incontinence, you want to be doing about 3 months of consistent pelvic floor strengthening to make a difference in your incontinence. So it does take a little bit of time to build up strength in it, but it's really, really effective. So the research is really, really positive for it. And it's shown to be really helpful and effective, and definitely worth doing it. So try this pelvic floor strengthening exercise now while you're listening to me. So these are just kind of general guidelines for it. I find it's easiest to start in sitting, so you can just get a little bit of a better feel of what's happening in sitting. So if you sit up tall, I'm going to get you to sit on your hands. So if you place your hands underneath the bony points of your sit bones, so you should feel kind of the bony parts of your bum underneath your hands. This is mainly to make sure that you're not using other muscles to try and help, like squeezing your glutes instead, and to just give you a little bit of, I suppose, a feedback of what you're trying to feel. So sitting on the hands, it's a very small movement. No one should see you doing it. It's not like a movement with your back, a movement with your pelvis, or squeezing your bottom. It's just an internal movement. So no one should see you doing it. It's very, very small and subtle. So if you imagine that you are drawing your sit bones together and drawing your hands together, but you shouldn't feel any tension increase underneath your hands so that you're not squeezing your glutes. So I like to use the analogy of an elevator. So if you imagine that you are stepping into the elevator and the doors are closing of the elevator, so that's your sit bones drawing together. So just imagining that. The pelvic floor is a long sling of muscle. So if you first imagine that you're trying to stop wind from the back passage and then coming forward through to stop urine from the front. So that's contracting both areas of the pelvic floor, which is also important to strengthen it throughout. So you're stepping into the elevator, closing the back passage, front passage, and then you're just holding. So seeing if you can lift it slightly, go up a few floors in the elevator and hold it at that point. So just as strong of a contraction as you can get, hold it for as long as you can, count how long you can hold it for. And then once it releases or it gets tired, just build up from there. Just give yourself a little bit of rest and then trying again. So the goal is to be able to hold this for about 10 seconds and for it to not really waver in terms of strength. So you want to be able to hold a pretty good contraction for 10 seconds. That would be the goal. And be able to repeat that a few times as well with rest in between. The other strengthening exercise that's important is doing quick flicks. So the first exercise is more for endurance and getting the general strength of that muscle up. But the quick flicks are very important for that stress incontinence in terms of having a quick reactive force to a cough, to a sneeze, that the brain quickly connects with the pelvic floor and that you can actually contract it quick enough to prevent any leaking. So as well as your long 10-second holds, if you also try in the same position, just quick, stronger flicks and stronger contractions that you're squeezing, releasing, and you're trying to get as strong of a contraction as possible. The key with this one is to make sure that you're fully relaxing your pelvic floor in between each contraction. So it's quite normal for people to want to kind of squeeze and lift. But if you're not relaxing fully, you're not going to be able to get a full contraction either. So when the pelvic floor works with the diaphragm. So as we inhale and the diaphragm comes down, the pelvic floor relaxes, and vice versa. As we exhale, the pelvic floor contracts. So what can be a nice way to make sure that you're fully relaxing your pelvic floor in between each flick is to just inhale. Think about inhaling into your pelvis, and doing your quick flick again then after that. So this is just explaining that pelvic tilt a little bit more with a visual representative for it, and kind of going into those muscles that I was talking about. So after pregnancy, as I was saying, those lengthened abdominals, generally quite tight and restricted through the front of the hips, which pulls the pelvis forward. So you can see it's nearly like a pulley lever system. When the front of the hips and the front of the thighs are tight, those muscles insert into the top of your pelvis, so it pulls it forward a little bit. This then stretches and lengthens the hamstrings and the glutes at the back, as you can see in the photo. And the yellow muscles are the kind of weaker and stretched muscles. So it's very hard for a muscle to engage and contract when it's stuck in this lengthened position. And then you can see what happens with the low back as well, that the muscles in the low back have to overwork and get a little bit tighter, which then puts pressure on the low back and can lead to low back pain. So our goal there would be to lengthen the front of the hips, relax the back, and get the tummy to engage a lot more, and get the backs of the legs to engage a lot more, so you're rebalancing that system. So this is just to show you on the right side, you can see how we want the diaphragm and the pelvic floor to sit on top of each other. So going back to that initial posture photo of me where we showed my rib cage was thrusted forward of my pelvis and they weren't sitting on top of each other, you can imagine what that does for the pelvic floor and for the abdominal muscles, how hard it is for them to work properly when they're not aligned. So whenever the ribs are thrusted forward, there is a reduced ability of the diaphragm to work correctly because we want a three-dimensional breath. So we want, if you imagine an umbrella opening out equally either side, imagine that being your diaphragm. So we want equal expansion into the front of the rib cage, but also the sides, both sides, and the back of the rib cage as well. So pretty equal on all areas of that, as you can see in the photo. And what tends to happen with a lot of people, if the ribs are a little bit pushed forward, or a lot of people, even if they haven't had a baby, I see this in men all the time as well, that they have what's called a shallow breathing pattern. So this means that the chest is being lifted by your neck muscles when you're breathing, and you're not getting any expansion into the back and sides of the ribs. So it's sort of like it's a short, slow breath. So you're not getting expansion down and up. So that again reduces the ability of the pelvic floor and the tummy muscles to work. So the diaphragm works with the pelvic floor, as I was saying. As you inhale, the pelvic floor relaxes and comes down, and as you exhale, the pelvic floor moves up and naturally lifts a little bit with the diaphragm. So that's why it's nice to use breathing with your pelvic floor exercises. And usually we inhale through your nose and exhale through your mouth whenever you're doing it. So I will attach a few exercises for that rib cage mobility. So sometimes if the rib cage is sitting too far forward, it can be a case that there's just a little bit of stiffness in the back or the sides of the ribs from that pregnancy posture. So from not getting any breath into the back for a while, overusing the front of the rib cage, the back of the rib cage can just be a little bit stiff. So the squat breathing or the low seat back body breathing can help with that, because air takes the path of least resistance. So we want to block the front and force the air to go into the back. Then same with the lateral expansion. If you're not getting enough into the sides of the ribs, you can do a side lying exercise, which I'll show you as well. And then tying this all together. So whenever we're engaging our abdominals, we need to be able to breathe into the back and the side of our ribs, engage the abdominals at the front, and maintain a little bit of an engagement of the abdominals while we continue to breathe. So you can imagine if we're only able to breathe into a shallow pattern, lifting the rib cage up and down, and we're not getting any air into the back and side of the ribs, the abdominals are being lengthened each time you breathe up. So it's really hard to hold any tension in those abdominals if you're not able to get air elsewhere into the rib cage. That's the idea behind that. So again, I'll attach a video of that you can try. Usually if you do your back body breathing, lateral rib expansion, so you're getting the air to come into those areas first, then trying to get the abdominal engagement and the brace with the breathing, that's the best way to do it, because a lot of the time the back and the sides of the ribs are stiff anyway, and it's a lot harder for you to get that correct alignment and correct engagement of your tummy if this is the case. So then for the pelvic tilt as well, I'll show you a couple of basic exercises that you can try and get started with. A lot of people even find it hard to just move their pelvis separate of anywhere else in their body. So kind of isolate that movement can be quite hard for people. So just getting that awareness and trying to feel where your pelvis is throughout the day as well is important. And then starting to get the back of the legs to kick in a little bit more again, as we were saying, again, that pulley system to pull you back. Then the scissors, maintaining a neutral spine, is basically getting you back into that neutral alignment. So that better posture where your rib cage is over your pelvis is kind of tucked back under, so it's not in a anterior pelvic tilt, that you can engage your whole canister of support and your whole core correctly. So engaging those tummy muscles without the back working. If you're not in that neutral alignment and you're kind of stuck in that ribs thrusted and anterior pelvic tilt posture, and you have a lot of space underneath your back whenever you're lying on your back, the low back tends to want to try and do the work of the tummy instead, because it's used to overworking. So this is why we want to get that alignment better and the tummy strengthening as well. So again, this is just a little diagram to show you why we want to use breathing with both pelvic floor exercises and both the tummy strengthening exercises. So whenever the pelvic floor lifts, the deeper abdominals naturally draw in, and there shouldn't be much of a change in breathing. So if you have enough room in your rib cage, you have nice mobility in the back and sides of the ribs, you should be able to still have a little bit of movement in the diaphragm and be able to breathe while you're able to engage the abdominals and the pelvic floor. A lot of people tend to hold their breath when they're exercising, or, I would teach a lot of Pilates classes and find people would try and do stomach exercises and hold their breath. And this is generally just to try and get more pressure through their center, but it ends up that their low back tends to do a lot, and it actually ends up that they're bearing down and pushing down too much pressure on their pelvic floor. So if you get into a habit of sucking in your tummy, the top of your tummy, and holding your breath, that can actually put a lot of pressure down through your pelvic floor. Again, too much pressure that I can't tolerate. So, some people that I would see wouldn't necessarily have a weak pelvic floor, or wouldn't only have a weak pelvic floor, they'd actually just have a poor patterning of breathing or poor patterning of engaging their tummy and everything working together, which puts too much pressure down in the pelvic floor, leading them to leak then anyway. So it can be one or the other, or a combination of the two that can be the issue. So just a little guide, I suppose. As I said, this is for anyone post-pregnancy, not just initial post-pregnancy, but it's so important within the first 12 weeks not to do too much, because the muscles are healing, everything's healing. A lot of people think if they were running or exercising a lot during pregnancy that they should be able to go straight back into it after, but that's really not the case. Generally, if you do too much too soon, you can tend to see issues later on. You might necessarily get any issues at the time, but a couple of months or years down the line, you might be looking at, weakened pelvic floor, a little bit of incontinence, maybe prolapse, just if you put too much pressure through that system before it's ready. We want to get all of the basics right before you're able to go back to exercise. So starting with basic gentle pelvic floor strengthening once healing of your pelvic floor has taken place is important, and that's generally the first step, is taking it easy, just starting to engage the pelvic floor a little bit. But then it's important to work on that canister, work on that alignment, strengthening, everything working together as a system in order for your body to work as well as it should and kind of function as a unit, as I've explained in the last couple of slides. So where to go from here? To return to exercising after having a baby, again, no matter how long, or in general, some people who haven't had a baby will actually end up in this posture just from sitting a lot during the day. We want to correct the posture and alignment. So you can start even by thinking about this during the day, you know, imagining a string pulling you from the tip of your head. You're tucking your chin in, you're growing long, you're bringing your rib cage back and in over your pelvis. You're engaging your tummy muscles, tucking your pelvis under a little bit. So you're kind of coming into that posture that was on the left versus on the right in the initial slide. Get the breathing right. So again, being able to make sure you can get that 3-dimensional breath. Then we look at making sure that the pelvic floor is strong and it's able to contract at the right time that we want it to, and that you can get the correct core engagement, core strengthening without too much pressure on the pelvic floor. So you're not forcing, bearing down, getting loads of work through the top of the abdominals and pushing too much down on the pelvic floor, that they both need to work very much together. And then it's just about being able to, once this has been improved and taught and strengthened, it's just about gradually building that into day-to-day tasks. So what we generally do is maybe start with pelvic floor strengthening and lying. If someone can't find, you know, what their pelvic floor work should feel like, bring them up into sitting, get their breathing right, get them engaging pelvic floor with the abdominals, keeping the breathing as well, and then just gradually bringing that into harder tasks. So like doing a squat, doing a lunge, things that you would have to do during the day if you bend down to pick something up and things like that, and just gradually getting you stronger and stronger to be able to tolerate the load that way. But the key is really that we get that alignment and posture and the whole center working together before any of this can happen. So if people kind of learn poor compensations, then it's a lot harder to reverse them. So then it's just, gradually loading specific to the person and depending what they want to do. So whether they want to get back into running or whatever is important to them that they want to do. So what we do in here then is we do an individual assessment, looking at the posture, looking at what's going on, what your goals are, and then incorporate the basics and bring you through progressions to get you where you want to be, kind of basing it all around those kind of things. Okay, so that is it. I hope you enjoyed the presentation. I hope it gave you a little bit of a basic insight into what's going on post-pregnancy and why a lot of people post-pregnancy tend to struggle a little bit getting back into exercise. But I'm always open and happy to answer any questions. So if you want to, you know, send me an email, ring up the clinic, book in for an appointment, do feel free to just get in touch and let me know.